Have you ever wondered why the NHS is in the state it's currently in? The government telling the public that the NHS would not work, couldn't work, shouldn't work.
Let's talk about what happens if the NHS is actually privatised and we move to an insurance-based system, because I don't think people realise how dangerous it would be. The concept of privatising that, of losing that, of moving to an insurance-based system is frightening as hell.
Guys, you just don't know what it's like. Go and live in America and experience a two-tier system, insurance-based medical system, and then come back and see if you'd like to scrap the NHS.
Why is this happening? Well, it's happening because politicians have pushed NHS privatisation. They've enabled private companies to infiltrate the NHS.
Also have to pay for the private owners of the healthcare system so that they can make millions and billions of dollars off of other people getting sick. And the sicker the population is, the richer these owners of these private healthcare companies become.
So the idea that it's going to be £50 a month if we just get rid of the NHS is absolutely the most insane propaganda that anybody could fall for.
The NHS model doesn't work and how people are very unhappy with it. Now, people are very unhappy with the NHS, obviously, but it's not because the NHS's model doesn't work, it's because it hasn't been funded and treated correctly.
Figured it out. Trust me, I figured it out. Trust me, you're going to want to stay for this one. I figured out how to save the NHS.
Welcome back to Brit Rants, where we say what everyone's thinking while they try to sell off what's left of Britain. Today we're talking about something sacred, the NHS. Born from the rubble of war, built on the idea that healthcare is a right, not a privilege, the NHS is one of this country's proudest legacies. It's something we all pay into, and something we should all be able to rely on. But now, it's being stripped for parts. They won't admit it, but make no mistake. We're watching the slow privatisation of the NHS. Waiting lists grow, GPs vanish, and private companies circle like vultures. And behind it all, the same agenda we see in America, an insurance-based system where care depends on what's in your wallet, not what's wrong with you. That is not the Britain people fought to build. If you believe in defending what's left of our healthcare system, hit subscribe and let's fight for it before it's gone.
People who advocate for a for-profit private healthcare model over a socialized healthcare model is absolutely mind-boggling to me, because their argument goes something like this. Why should I pay into a socialized healthcare model where I not only have to pay for my own healthcare, but the healthcare of others in taxes, where the goal of paying into this healthcare system is to make the population as healthy as possible, and the healthier our population is, the less we all have to collectively pay in taxes, because healthy people don't need healthcare. No, I don't want that. Instead, give me the for-profit private healthcare system where I not only have to pay for my own healthcare and the healthcare of others, but I also have to pay for the private owners of the healthcare system so that they can make millions and billions of dollars off of other people getting sick. And the sicker the population is, the richer these owners of these private healthcare companies become. That's what I want instead.
Let's talk about what happens if the NHS is actually privatised and we move to an insurance-based system, because I don't think people realise how dangerous it would be. I'll preface this by saying I've dealt with private healthcare in the UK with insurance, private healthcare in America with insurance, and the NHS, and I will say the NHS always comes out on top. What people don't realise with insurance is it will be based on your pre-existing conditions or anything that you're at risk of. So if you have endometriosis, if you have a pre-existing condition that the NHS has already diagnosed you with, your insurance will cost an arm and a leg. And I know people will say, well, we already pay national insurance every month. It's kind of like insurance for healthcare. If you are high risk, you have to double, probably triple, quadruple that amount every month. And even then, your medication, your scans, your treatment may not be covered. I was in America and I had the best insurance, and I had scratched my eye with my contacts, and I went to the A&E department, and not only did they not cover my visit, but when I had to pick up my prescription, instead of like the UK, a subsidised amount that's fair for everybody, £9.90 or whatever it is, it was £90 for eye drops. A small bottle of eye drops, £90. That was covered with the best travel insurance I had. But not only that, if you cannot afford insurance, if you lose your job, if you cannot pay your mortgage and your health insurance every month, be prepared to get very sick or go bankrupt. And you can forget wanting to call an ambulance, because no one in their right mind is going to pay £2,000 to get to the hospital unless you are absolutely desperate. And you'll probably be stumped with a huge bill when you have children also. Depending on whether you have a cesarean or complications or additional medicine, you are looking at thousands of pounds. Even with private medical insurance in the UK, the anxiety of, first of all, you have to pay the excess before you even get seen by a doctor. That's like £100, £150, however much your excess is on your policy. But then also you don't know what's going to be covered. So you have to consistently ask. It's this anxiety thing of, I can't do this, I can do this. It is exhausting and anxiety provoking and scary. We are so incredibly blessed to have the NHS. We're so incredibly blessed to have ambulances for free, A&E for free, a GP for free. We are so incredibly blessed. And no, it is not perfect. You might have longer waiting lists, or, it might be a little bit frustrating at times, but it's free. It doesn't discriminate whether you are rich or poor, what background you're from. You have access to healthcare, which is a fundamental human right. The concept of privatizing that, of losing that, of moving to an insurance-based system is frightening as hell. And there are certain political parties and political figures that are trying to move to this insurance-based system, and I can tell you it will be the worst thing to ever happen to the UK. Any political party that is trying to take away free healthcare as a fundamental human right is a red flag. So please, next time you think that the NHS is not valuable or that we're better off in a different system, think about the actual implications of that.
We don't need the NHS. Private healthcare only costs about £50 a month in the UK, is what I heard out of somebody's mouth yesterday. Oh, my sweet summer child. When you go on Bupa's website, the first thing that pops up, it says, any pre-existing medical conditions, we don't cover those. Emergency care, get yourself to an NHS hospital. The idea, everybody's seen Adam Kay, right? The Diaries of a Junior Doctor. He did a play, he did a show. I saw the play, it was very good. And there's a joke in it at some point where there are people who are under private healthcare who are giving birth, and the second that they have a complication, they're literally shipped off to an NHS hospital to finish recording inside. The people who are currently on private healthcare in the UK are generally middle class wealthy people. Insurance systems work off of a risk, right? So if the population of people who are currently on private healthcare generally are middle class people with decent amounts of money, who often live very healthy lifestyles and have access to live a very healthy lifestyles, the risk on the insurance system is obviously lower. So if you suddenly put in a population of people who are higher risk of higher health complications, which tend to be poorer and working class people who obviously work in jobs which usually involve more risk or have a higher toll on the body. The idea that the £50 a month would stay anywhere near the same. The £50 a month quote is the most basic coverage with no pre-existing conditions, with an extremely low risk person. The second you start answering questions about your lifestyle, about what you do for work, about history in your family, that number goes up very quickly. And again, that insurance system is based off of an entire population of people who are poorer and working class, who suffer from more health conditions in this country. They're out of the data. They're not included in that data, and the profitability of the current insurance model in the UK. So the idea that it's going to be £50 a month if we just get rid of the NHS is absolutely the most insane propaganda that anybody could fall for.
People who think that private health insurance in the UK, if the NHS was scrapped and we were given a privatised healthcare system, would be £50 a month are absolutely delusional. It would not be £50 a month. I have private health insurance currently, and it doesn't cover that much. It certainly doesn't cover enough for me to not have access to socialised healthcare, and that costs me £50 a month. My family in Australia pay hundreds of pounds a month for their private health insurance because it is more of a two-tier system there than it is in the UK. Guys, you just don't know what it's like. Go and live in America and experience a two-tier system, insurance-based medical system, and then come back and see if you'd like to scrap the NHS by voting for UK reform. It is most people will not be able to afford healthcare. Okay, even if you guys stopped paying your national insurance out of your salary, you still would not be able to afford private health insurance. You wouldn't be able to. Okay, and then you're going to be relying on a company giving you healthcare and insurance, which means that if you lose your job, you have no access to healthcare. Okay? Do you understand that? Do you understand that?
This idea of patient choice is just a way of corporatising the NHS. Let me explain what I mean by that. Keir Starmer's going to be releasing a radical new plan for the NHS this morning, and there's a lot of chat about how it's going to increase patient choice within the system. When you talk to patients who can't get access to NHS treatment right now because the waiting times are too long, they do not talk about wanting to be given a range of healthcare providers to pick from through an app. They talk about wanting their local hospital to work properly and their local GP surgery to work properly. And yet, politicians have been going on for years and years about the need for patient choice. Why is this happening? Well, it's happening because politicians have pushed NHS privatisation. They've enabled private companies to infiltrate the NHS. Keir Starmer and Wes Streeting have been pretty clear that they're positive about private company involvement in the NHS. And I suspect what these plans are going to show today is that they will have updated the NHS app so that when patients are seeking treatment, they are given a range of healthcare providers to pick from, many of which are profit-seeking private companies who've been enabled to involve themselves in the NHS. We need to push back against this. If the new government wants to rebuild the NHS, then they need to be investing in the publicly owned, publicly run services. NHS patients don't care about choice. They want the public service to work properly. If you agree with that, would you help us run our campaign? We're running a massive campaign at the moment to rebuild the NHS. We've built a doctor's manifesto for the NHS. We've been bringing it to MPs. 117 MPs and their teams are so far involved. We've got a lot more work to do. Could you click on my bio, click on the link tree, click on the crowdfund, donate £1, follow me, share this, put a comment underneath, put it in your favourites. Let's make sure people understand what this patient choice idea is, because it's certainly not putting patients first.
Here's where I'm at with NHS England abolishment. My question to the government, if you can hear my child, I apologise, is, okay, you're abolishing NHS England. I can get on board with the principle and the rant and what you're saying, but the message you're giving to the public is it's going to help take people off wait lists, it's going to deliver more care quickly and all the rest of it because you're going to give more money. We are in a massive staffing crisis. We do not have people, any qualified nurses and midwives coming to the front line regardless. We have massive vacancy gaps as it is. So whilst it's amazing that you have this money, and I'm not saying don't give it to us and don't put it on the front line, how do you envisage us shortening any wait lists when there are no more staff? How are we doing that? Because the staff that work in NHS England do still need to go to Department of Health. There are going to be other jobs that are required. There is still a system that needs to run. So by abolishing that I just think I need people to understand we still have no staff. So until that's sorted...
Figured it out. Gus me, I figured it out. Trust me, you're going to want to stay for this one. I figured out how to save the NHS. Right, just hear me out on this. Right, so we got politicians. They don't use the NHS. 90% of them, they've got private healthcare. Prove me wrong. Now these politicians, they think in the back of their... Let the muggles use the NHS, that shit ain't for us. We've got private healthcare. Well, if you implement my solution today, I guarantee you tomorrow NHS will be sorted. My solution is make it illegal for all of the politicians to have private healthcare, which forces them to now use the NHS. Oh, and watch it get sorted tomorrow. Overnight, bro. Not even, you know what? Not even 12 hours later, and the NHS will be sorted. I guarantee you on that.
British healthcare, pros and cons. So I'm a Brit living in California. I get a lot of comments of people asking me why I would leave the UK and come to the US when I had free healthcare. So massive pro of the NHS is that it is free, therefore paid for through your taxes. You do not have to go to the doctor and think, oh my gosh, how much is this going to cost? Or you don't need to find a lump and think, do I go to the doctor because it could cost me a fortune? You just go to the doctor. You just go and see a specialist. You do what you need to do, and you don't need to worry about the cost or the bill. You don't need to have a medical degree. You don't need to understand co-pays and insurances and any of those things, because it is all covered for. And I think that that is a massive bonus. I personally think everybody getting access to healthcare is a wonderful thing. I don't like the idea of anybody dying because they have any type of illness, purely because they cannot access cover. Downsides, wait times. So I did have a grandparent who called an ambulance. They were told it was an 8-hour wait, and in the end the ambulance just cancelled. And I think we drove them in to like the walk-in centre or A&E or the emergency room, whatever you want to call it, for them to be seen. Fortunately, we were able to do that. But you do hear of people who maybe have a heart attack and who spent hours waiting for an ambulance. You do hear of people that need to see a doctor and can't see a doctor. You do hear of people getting cancer and not getting treatment in time because the wait lists were too long, or needing surgery on their arm or their leg or their back or whatever it is, and actually having to pay to go privately, so because otherwise it's a year or a 2-year wait. So that is a massive downside. However, my view of the NHS personally is that it's just not run properly. I don't feel that it's because too many people are using it. I feel it's literally because it's not run properly. We have so many managers in the NHS and they're just not needed. I actually worked for the NHS for a period of time, so I do feel that I have some experience in talking about that. I feel if we cut some of the upper management and manage the NHS properly, I feel like it's a brilliant system that works for 99% of people in the UK, and I personally think that it's brilliant. I am going to do a pros and cons on American healthcare, so come and watch that one.
Have you ever wondered why the NHS is in the state it's currently in? It can be so confusing because people will say it's the fault of the Tories, or it's the fault of Blair because he set up PFI projects, or it's the fault of Margaret Thatcher because she started on privatisation, or it's the fault of a growing population, or it's the fault of an ageing population, it's the fault of the greedy patients, it's the fault of the lazy GPs. Like, the GPs are not lazy. GPs are working unbelievably hard at the moment. What's happened is when the NHS first set up after the Second World War, the only reason it got set up is because millions and millions of people wanted society to work differently. It's not the only thing that the British government were putting in place in order to improve our society and care for people better. But it's probably the thing that most people are aware of because we all rely on it, and it has changed millions of people's lives. But even back then, there were a lot of people telling the government, telling the public that the NHS would not work, couldn't work, shouldn't work. And ever since then, there has been a lobby group of sort of interests, corporate interests, think tanks, politicians, rich folk who haven't wanted there to be a socialised healthcare system in the UK. And from the 80s onwards, those people have had a growing influence on what happens in the NHS. Every government since Thatcher has enabled privatisation within the service, but they've done it very quietly. They've done it through legislation, and they've done it while telling the media that they love the NHS, they support the NHS, they want the NHS to work. It was particularly confusing during the Blair and Brown era because they pumped a huge amount of money into the service while they were also advancing privatisation, and it meant that the service functioned better. The waiting list came down. A lot of people had a better experience in the NHS. But when the Tories pulled the money away in the 2010s because of austerity cuts, as they referred to them, we saw all the cracks. This is why, because of privatisation, because they've fragmented the service into its component parts, it doesn't work very well anymore. People get a patchy delivery of healthcare across the country. People in some places will get a different experience to people in a different place. The funding is very patchy, service provision is not robust, and it's getting worse and worse, right? This government, this Labour government, should have come in and reviewed all of that and worked out how to change things so that the public service was brought back into public hands. We removed the private outsourcing from the service and we increased the investment, because just to be completely frank, medical advances over the last 7-8 decades have meant that a service of the type that the NHS is meant to provide would be very expensive, but it's also a priority to the public. The new Labour government, if they were going to do anything, would be to talk to the public about what they really wanted from their healthcare system. And if they wanted to continue to offer what the NHS is meant to provide, which is a free, equal, comprehensive healthcare system for everyone, they would have to have a sensible conversation about how much money that was going to cost. That is not what they've done. Instead, Keir Starmer, when he was trying to become leader of the Labour Party, campaigning for it, he told everybody that he was going to remove private outsourcing from the NHS, which would have been a really good thing. And I know loads of people who voted for him specifically because of that. But he quietly dropped that pledge in the summer of 2022, and just last week he's just announced that he's going to be advancing NHS privatisation. We cannot expect this government or any other to be able to rebuild the NHS while they are still advancing privatisation. They are still enabling corporate interests into the NHS, and they are still enabling private shareholders to make money. If we really want the NHS to work, if we prioritise it, and I think we do, because I speak to so many people online, like this is my whole life, right? And it's one of the most important things for people in their lives. They recognise the value of the service when it works. Then we're going to have to fight for it now, because unfortunately all of the kind of influences that are powerful in our country are combining to just pull us further down this trajectory towards privatisation. We have a mostly privately owned right-wing media owned by billionaires, and they are putting out lots of messaging now about how the NHS model doesn't work and how people are very unhappy with it. Now, people are very unhappy with the NHS, obviously, but it's not because the NHS's model doesn't work, it's because it hasn't been funded and treated correctly. We've got politicians telling us they want to rebuild the service while, funneling out more and more public money into the private sector, which actually doesn't benefit patients. And we've got think tanks, very powerful think tanks in the UK, who are putting out messaging into the media, often writing reports, which kind of make out like the NHS isn't fit for purpose anymore and it needs to be scrapped. People often tell me online that we'll never end up with a US-style healthcare system, that I'm being a scaremonger, but just if you look at the trajectory of where we were 40 years ago, where we are now, the amount of money that's being funneled out of the NHS, the shrinking of the provision of public healthcare in our country, the millions of people suffering, and the massive and rapid expansion of the private healthcare sector, I think you'd be as scared as I am. It's the vulnerable people who will suffer first. It's the people who can't afford to pay for healthcare insurance. It's the people who don't have savings. It's the people with rare conditions who won't be put on one of these elective waiting list drives that Keir Starmer has announced. And we've all got to fight, right? And now fighting puts a lot of people off. I understand that. I didn't used to think of myself as even political. I would have hated to think that I had to go out and fight for anything. But when I got involved in all of this, I was absolutely appalled, guys. And fighting can mean writing a letter to your MP through a Contact Your MP tool. Fighting can mean following somebody like me and sharing what they're saying. Fighting can just mean talking about it. We've got to start talking about this. We've got to start talking about it. And right now, there's an emergency in A&E departments. And the reason that emergency has occurred is because politicians made the wrong decisions. Politicians were advised by healthcare leaders that they needed to invest in A&E departments and emergency services, and if they didn't, there may be a disaster this winter, and they chose not to do so. They chose to make announcements about AI. They chose to develop partnerships with private companies. We're going to have to hold them to account. If you have watched to the end, that's a very long video. I'm sorry it's been so long. Click on my bio, click on the link tree, contact your MP. It takes less than 30 seconds. We're running an emergency meeting about this next Wednesday. Let's fight for it, because if we don't, guys, I dread to think what's going to happen.
I'm so fed up of hearing politicians make out that it's ideology that is making people oppose NHS privatisation. There is mounting evidence that NHS privatisation creates harm. There was a statement yesterday from Keir Starmer where he was explaining that they were going to increase independent sector involvement in the NHS, which means private companies involved in the NHS. And he said this: "We will not let ideology or old ways of doing things stand in the way of getting people's lives back on track." Now, let's be honest, we all want people's lives back on track. Millions of patients can't get the care that they need in the NHS right now, and that's because politicians have decimated the service. But we do not need more NHS privatisation. There's been a couple of studies that have come out in recent years that I'm just going to tell you about, because it is very powerful, and our politicians should not be entertaining more privatisation in the NHS right now. So in 2022, an analysis came out from the University of Oxford. They'd been looking into outsourced healthcare services in the NHS, which means that external organisations are running services, including major private companies. And they looked at the period between 2013 and 2020. Here's a line from their findings. Private sector outsourcing corresponded with significantly increased rates of treatable mortality. That's avoidable deaths, by the way, potentially as a result of decline in the quality of healthcare services.
Does that sound like something that we should be continuing with or indeed expanding within the NHS right now? And then there was another analysis that came out this year in 2024, again from the University of Oxford. And this time they'd been looking at lots of different healthcare systems in high-income countries. And they have a quote that says, increases in privatisation generally corresponded with worse quality of care. Why is the new Labour government pushing more NHS privatisation? We believe, every doctor, the organisation that I run, that the NHS could be rebuilt without privatisation if politicians had the political will. And I believe that if we could find millions of people who care about this, we could push for that to happen.
Just when you think you have heard it all, have you seen in the news that this week they have launched a private ambulance that you can call? So it's £99 for this ambulance call out, but you're going to need to be able to pay. Apparently they're not going to respond to medical emergencies. It's for people that would normally need to see a GP, but there'd be a 2-week wait, or if you have any concerns, surely you shouldn't be going to A&E for that anyway. Yeah, there's a stretch on primary care, but things you would normally go and see your GP for, that's just going to add to the waiting times. But this is disgraceful. So we Sheila, who is on her old age pension, or Sue, who is a single mother on benefits, they're not going to be able to do any of this because they can't afford it. So we're totally introducing a 2-tier healthcare system, which the NHS is supposed to be the opposite of. I just think this is a ridiculous idea. I mean, fair dues if you have got the money and you want to pay £99, but this isn't what universal access to healthcare is about. And also, it's so ill thought through. They're going to come to A&E for something they potentially shouldn't be going to A&E for, and then they're just going to join the huge waiting lists. Who comes up with these ideas?
There's been a terrible development about NHS privatisation in the last day, and you might not know about private finance initiatives, so let me explain what's going on. Some terrible schemes went on about 25 years ago where politicians convinced the public that they couldn't afford to pay for new NHS hospitals and other infrastructure, and so they partnered with private companies who put up the initial investment. And it sounded too good to be true because we didn't need to spend money from the public purse in order to build things, and the politicians told people that over a very long period of time we'd pay the private companies back and everyone's a winner, right? Except everyone isn't a winner. In the NHS in England, the private companies initially put up an investment of about £13 billion, and by the time we finally pay all of this off by 2050, the public will have paid 80 billion to those private companies. They also, the politicians, entered into some terrible deals back then that meant that some of these hospitals had maintenance contracts which could only be done by those private companies, and it's led to situations where basic maintenance repairs like changing a light bulb have been charged to the NHS at much higher costs than they would have been done normally. We're talking hundreds and hundreds of pounds to change a light bulb, that kind of thing. It's been ridiculous. It's also been up to each of the NHS trusts to pay back this money, and so some of our NHS trusts have been absolutely crippled with this for decades now. They're now talking about going back into these private partnerships with the companies, different companies perhaps, I'm not really sure, to pay for some of the repairs that need to be done in the NHS. Now, it is true that the NHS is in a state of absolute emergency in terms of the state of its buildings. There's a situation in England alone where there is almost £14 billion worth of unmet repairs at the moment, and it's terrible. There are crumbling buildings, there are sewage leaks, there are vermin infestations. We've got a terrible situation, right? But private companies are not the answer. And actually, the Tories realised this back in 2018. They stopped these private finance initiatives from happening. The idea that we now have a Labour government and that Labour government might turn this around and involve more private partnerships in our NHS buildings is an absolute travesty. It will land the public into debt for decades to come, probably, and we shouldn't be encouraging it, and we need to push back. And I'll continue looking at what's going on and trying to find information, and I'll share it all with you. So give me a follow, share this, pop this in your favourites if you're concerned about NHS privatisation, because it looks like things are about to get a lot worse.
The NHS isn't perfect, but it's ours. It was built so that no one, rich or poor Klaus, would go bankrupt from being ill. Now, we're being pushed toward a 2-tier system where the rich skip the queue and the rest of us just wait. This isn't progress, it's a disaster, wrapped in the language of modernisation and choice. But we know what it really is: profit before people. The insurance model has failed millions elsewhere, and we're next, unless we push back. Because once the NHS is gone, it's never coming back. Protect it, call it out, share this, and subscribe to Brit Rants, because silence is exactly what they want.